女士们、先生们，大家上午好，欢迎出席国务院联防联控机制。
Welcome to the press conference of the State Council's Interagency Task Force on COVID-19 Response and Control. We're happy to have Mr. Zheng Yixing, Vice Minister of the National Health Commission and Director of the Vaccine R&D Project under the State Council's Interagency Task Force. Madame Li Tao, Deputy Director General of the National Healthcare Security Administration, and Mr. Cui Gang, official of the Bureau of Disease Prevention and Control of NHC, and Mr. Zheng Zhongwei, head of the Vaccine R&D Working Group under the State Council's Interagency Task Force, and Mr. Wang Huaqing, CDC Chief Expert on Immunization Program, for a briefing on the latest developments of COVID-19 control and the progress in vaccination, and take your questions. Now I will give the floor to Vice Minister Zheng. Friends from the media, good morning. COVID-19 is a global pandemic unprecedented in a century, with the virus still raging on across the world. Though China has made major strategic progress in epidemic control, the latest developments in Hebei show that we still face a serious and complex situation and daunting challenge in this winter and coming spring. With still great pressure of prevention of imported cases and domestic demand, we need to implement the instructions of General Secretary Xi Jinping and implement the decisions by the Central Committee of the CPC and the State Council, take decisive measures, race against time to implement all kinds of control measures to stem the spread of COVID-19, protect the public health, safety, security of the capital, and consolidate our progress, hard won. As Spring Festival is approaching, there will be more people coming back from outside China, more people will be traveling within China, and more cold chain food and goods will be imported. This will mean higher risk of spread of this virus. The leadership pay high-level attention to the epidemic control in the coming months. So no slacking of efforts, no weariness, no letting up will be allowed. And measures of preventing case importation and domestic rebound will be taken to ensure good protection in the coming spring and this winter. Vaccination is the most effective weapon for the control of a pandemic, and since December the 15th, we have started the vaccination of key groups of populations, and now we have injected over almost 7.5 million shots, and apart from the 1.6 million jabs, we have already given almost 9 million shots of vaccines in China. We have already established sound management rules for vaccination sites, provided training to medical workers, conducted screening for the recipients, conducted monitoring of adverse reactions, provided ensured emergency treatment, and also we conducted consultations of experts for adverse reactions to ensure everything goes smoothly in the vaccination. Now, the fact that 9 million of shots have been provided proves again that China's COVID-19 vaccines are safe. Now, with the conditional market approval of vaccines, especially our capacity of production is coming up, we will, in an orderly manner, provide vaccination to high-risk population and also the ordinary people, and provide free vaccination to all the people to make sure people have need will be vaccinated to build a shield of immunity to stem the spread of the virus in China. Thank you. Now let's open the floor for Q&A. CCTV. Now, Vice Minister Zheng mentioned the latest developments in Hebei, and there are quite a few cases in Hebei. So what is the situation on the ground? And as the Spring Festival is coming, what measures should we take to ensure good protection?
I will take your question. Until 24 hours yesterday night, within the last day, the newly confirmed cases in Hebei was 14, and there were 16 newly confirmed asymptomatic cases. Since January the 2nd until today, we see a total of 137 newly confirmed cases and 197 asymptomatic cases. The CPC Central Committee and the State Council attaches great importance to the emergence of cluster cases in the province, and President Xi Jinping made instructions. Premier Sun Chunlan also went to Hebei together with Mr. Ma Xiaowei, head of the China's National Health Commission, have visited Hebei. We've also dispatched medical experts to the province to provide guidance. Relevant authorities in Hebei have rallied up and put in place appropriate response measures. People in the province are also working with the government. I believe the situation in Hebei will be put under control in a timely manner. What we see now shows that COVID-19 containment in spring and winter remain complex and challenging. With Spring Festival coming, there will be more people flying back from overseas, and there will be more travel of domestic residents. There will be more gathering, and the delivery of cold chain products and goods will also grow. The CPC Central Committee and State Council takes this issue very seriously. There will be no lowering of guard or chance-taking. We will take firm measures against inbound cases and domestic resurgence to hold up the line of defense in winter and spring seasons. In this process, we will see that individuals will continue their protection measures, such as mask wearing, hand washing, and social distancing. These will reduce the risks of individuals getting infected. We will also reduce gatherings, including dinner parties, and discourage people from going to places with a dense population, in particular indoor places. We will also step up ventilation and disinfection of public spaces. Homes and offices will be required to open windows to let air go through. We'll also pay special attention to sanitation in elevators and bathrooms, and to make sure that their electric fans function well to ensure good airflow. We'll also take measures to encourage staggered travel and online shopping. We'll also refine spring holidays for students and stagger the start of new semesters. We will encourage people to remain in the city where they work for the holiday. For public spaces, such as meeting activity for meetings and scenic spots, containment protocols and restrictions for the flow of people shall all be strictly observed. In particular, the following will be our key priorities. First, to step up monitoring and information reporting on COVID-19. This is the first step for us to timely detect any cases. We will provide testing, expand the scope of testing, and provide testing to all those who need to be tested. We'll increase the frequency of testing and make sound preparations for the test and reporting in fever clinics. Whenever cases arrive, they shall be reported truthfully and in accordance with the law. There shall be no hiding or underreporting. Second, we will strengthen the containment on both people and goods arriving from overseas and provide standardized services. We will strengthen the transfer and the picking up and dropping off of people arriving from overseas and step up their home observation management. Third, we will also step up hospital-acquired infection control. Medical institutions, in particular those at community levels, need to refine their protocols. They need to designate people to take relevant responsibilities and carry out routine checks. We will reassess existing hospitals and fever clinics to troubleshoot and make speedy adjustments. We'll make sure that there are enough facilities and personnel for the management of fever patients. Fourth, we will step up emergency response to cluster cases. We will improve the existing emergency mechanism of jurisdictional responsibilities plus regional coordination for better efficiency. We will carry out simulations and step up our work on disease control, treatment, testing, and epidemiological investigation. We will, in particular, pay attention to epidemiological investigation and source tracing. Fifth, we will strengthen coordination to make sure that key groups get inoculated, and they get inoculated in a timely, standardized, and safe manner. We will work for the full coverage of people without contraindications to get inoculated. At the same time, we will work on the reporting and handling of suspected adverse reactions and provide pre-employment training to our medical workers. These will ensure that our inoculation work will go forward smoothly. Next question, please. Thank you. From CGTN. Starting from last December, we've started emergency inoculation to key groups. How our work now and how will our work on inoculation go forward? We'll invite Mr. Cui to take your question. Starting from mid-December last year, we've carried out inoculation on key groups. Localities in China have earnestly implemented the decisions of the CPC Central Committee and the State Council. Under the principle of region-specific ports first and on a priority basis, relevant work has been carried forward in an appropriate and orderly manner. Various localities have set up a working mechanism and established task force on inoculation. So from mid-December, which is December the 15th last month, till today, we have in total administered 7.383 million doses. Together with the emergency plan inoculation, we have, as previous speaker have said, over 9 million doses have been inoculated. Now our work is moving forward smoothly. Various regions and departments will focus on the following. First, identification of key groups in light of containment work. We started inoculation on the basis of significant results of our COVID containment. Our current priority is the prevention of case importation and domestic resurgence. So on that basis, we have identified people working in ports, on international and domestic transportation, and other groups with high exposure of groups, such as those ensuring a smooth functioning of our society, those working in public services. They will be our priority groups. Getting them inoculated first will help move forward our line of defense, thus effectively lower the risk of importation and resurgence. Second, to make detailed preparation. The National Health Committee have put together professionals and have issued 8 very detailed technical protocols telling you what to do in advance, how to set up vaccination stations, how to organize people to get vaccinated, how to distribute and transfer vaccines, how to monitor and handle adverse reactions, etc. These are detailed guidance for regions and localities to implement. So in accordance with these technical protocols, different localities have come up with their own detailed inoculation protocols. They have also taken into account local needs, and around and nationwide, we have set up over 25,000 vaccination stations. We've put up professionals to make sure that training are provided for every link during vaccination. Third, standardized management of vaccines and inoculation. From provinces to cities to townships, our national health committees of all levels have made good use of the information system. We have set up logs to register the storage, the transport, and the usage of vaccines. So all relevant data can be traced back. Also, an important area using information technology is the monitoring and reporting of any possible adverse reactions. Inoculation providers, individuals getting inoculated, their information are also recorded accordingly. According to the demand of different localities, we've provided guidance to companies to supply enough vaccines, to step up the use and provision of vaccines. We use various measures to make sure that there is enough supply. Fifth, stronger treatment support. During inoculation, all places put safety as the top order priority. At all the places for vaccination, we have equipped them with medical personnel and facilities, as well as drugs that are of high standard. Despite a low incidence rate of adverse reaction, but in case of any such reaction, we will be promptly able to identify and handle such cases. 6. Sound monitoring of suspected adverse reactions. Various localities will act in strict accordance with existing protocols and plans and make sure that when adverse reactions arise, they will waste no time to report and handle. Thank you. Next question, please. Beijing News Daily. My question is about the free inoculation. Does free inoculation, I understand that free inoculation means that there will be no payment for the vaccine itself, but shall individuals still pay for the cost?
I will, Madame Li Tao and I will take this question together. First, I will give you an answer. Now, since December the 15th, we have started the inoculation program of key groups of population, and I will take this part, and Madame Li Tao will take the part of massive inoculation part. Well, President Xi Jinping always tells us that we need to put people and their lives above everything else. This is a strategic requirement. So during the inoculation of COVID-19, we must understand and implement his thinking, his decision. So the round of inoculation program for the key groups of population since December the 15th, we have required localities to do what we asked them to do during the NAT testing, that is to give vaccination to everybody in need, and no individual payment will be asked from people's pocket. So that means free, by free, we mean free for the expense of the vaccines themselves and also the vaccination. So I wanted to make it clear that vaccination is free, but also the vaccines are also free. Now, we found that some localities charged from people, so we have issued paper to ask them to rectify their mistakes. Now, in the whole, the policy of free vaccination has been generally well implemented across the country. The arrangement, this is the arrangement for the key groups of populations in vaccination. I will invite Madame Li Tao for the later part. Thank you for your interest. According to the decisions of the CPC Central Committee and the State Council, to stem the spread of the virus and to consolidate our progress to fully restore our economic and social activities, we provide free vaccination and vaccines to the whole people. Now, just now, Vice Minister Zheng talked about the free vaccination for key groups of population. Now, I will mainly focus on the part of free vaccines and vaccination for the whole public. Now, after a conditional market approval, we provide vaccines and vaccinations to the people with their consent, and the expenses of the vaccines and vaccination are covered, will be all covered by the government finance and medical insurance fund. People, individuals, don't have to pay anything out of their pocket. This is a very good testimony to the philosophy upheld by the Central Committee of the CPC with Comrade Xi Jinping at its core, that people are above everything else, and also speaks volumes to the advantages of our institutions. As we need to inject vaccines to a lot of people, a large portion of people, so it is important for us to have address the issue of expenses of vaccination. Now, we have taken this special measure in this special times to provide free vaccines and vaccination. We now have a surplus of 3 trillion yuan in our medical insurance fund, and we also have government finance. So we use these two sources of money, of financing, to cover the expenses of vaccines and vaccination. But on the other hand, people seeking medical services in other areas will not be affected either. In the long term, providing free vaccination is good to build for building a shield of immunity, and good for the development of our society and economy, which will in turn promote long-term and sustained development of our medical insurance. Now we are cooperating with the ministries to roll out a detailed action plan for the free provision of vaccines and vaccination, to make a good job in this policy and to implement the policy of RCPC Central Committee and the City Council. Now, next question. Thank you, Global Times. Now, there have been detection of a new variant of the virus from the UK in some places in China. So my question is, will the new mutation affect the protectiveness of our vaccines? Well, I'll take this question. About the mutation, this has been a topic of great interest. People are following it closely, and so at the beginning, we have established special research teams to monitor the mutation of the virus. Recently, as we have seen, in the UK, there has been a new variant of the virus, that is the mutation of S protein. That means the RBD domain. Amino acid in the RBD domain has mutated in the S protein. Now, there have been reports that there are cases that come in China from the UK with this new variant of virus. Now, as for will the new variant affect the effectiveness of our vaccines? Well, we pay a high level of attention to it. Recently, 2 institutes have made specific research on this. First, the China Medical Institution, and the other is the Virology Institute from the Zhongshan University. They have done enormous research on and test on this new variant. They put this new variant for the test of neutralization with the antibody of our vaccines in monkeys. Now, they have also compared the results of this new variant with the previous viruses that came up in the past few months. Now, the result is that the antibody that came in this test can still work and neutralize the virus. They have published their research results on a journal waiting for press. So this has injected confidence in us that our vaccines can still neutralize the new variant of a virus. So that means the mutated virus will not affect the efficacy of our vaccines. But mutation is an ongoing process. It happens every day, and the speed of mutation of the coronavirus is still within our range of acceptance. It is not that fast, but we still have to pay great attention to it. On one hand, we need to closely monitor the mutation of the virus. On the other hand, we must make good preparations for a possible result, for a possible scenario where our efficacy of vaccines will be affected by the mutation someday in the future. We must make good preparations in terms of technology. That is to make corresponding vaccines available for the mutation. Thank you very much. Next question. Thank you. Economic Daily, about the price of the vaccination. So how did we determine the price of vaccines, and is there a trade-off between free provision of vaccination?
Thank you for the question. I know you all have a keen interest in the pricing of vaccines and in free inoculation. As our previous speaker mentioned, we will provide vaccines to all our people for free. For free means that our people don't have to pay a dime for the vaccines. But still, of course, in the process of development, manufacturing, storage, and transport of vaccines, there are costs. So for companies, while upholding that vaccines are public goods, they will put a price on the vaccines, but the pricing will be in keeping with relevant costs. And this is the price with which the government, under due procedures, has procured vaccines from providers. And then the government will be able to provide vaccines for free to all our people. So this means that for the price of vaccines does not contradict free inoculation. Well, as production scale and the scale of inoculation expands, as well as with time, more vaccines will hit the market, pricing will adjust accordingly. Government departments, in light of possible changes, will also introduce new pricing mechanisms. We will make sure that vaccine pricing fall within the appropriate range of China's economy. So there's no contradiction between the two. Thank you. Next question, please. From Guangming Daily. We are all very interested in the effectiveness and safety of vaccines. During the process of inoculating key groups, are there any adverse reactions? Are there any things to watch out for?
Okay, I'll invite Mr. Wang Huaqun for this question. Thank you for your question. During our monitoring, to make sure the monitoring is as sensitive as possible, we demand reporting of all suspected adverse reactions in relation to the inoculation. Well, after the reporting, we will do verification, investigation, and conduct expert consultation. So our conclusion is that only a large proportion of those reported reactions are normal reactions. Only a small part of them are adverse reactions. We know that adverse reactions are normal for vaccines, and as you may have noticed, that vaccines have also been provided in other countries. There are also reports of adverse reactions, and some of them are serious adverse reactions. This is normal during vaccination. About the adverse reactions of China's vaccines, according to our statistics, 80% of the reported adverse reactions are normal adverse reactions. Only 6 out of 100,000 of them are abnormal adverse reactions. Usually they are allergic rash, other allergic reactions, including angioedema. And the occurrence rate of serious adverse reactions is even lower, less than 1 out of a million. So if we compare the statistics with the historical data, there is not abnormality. It is a consistent data. It is not too high, not too low. So about your question of what measures do we take after showing of adverse reactions, and how can we reduce the adverse reactions, we have protocol for the vaccination, and we ask localities to implement these regulations, and we also ask recipients to make some relevant preparations before they get inoculated. Before that, we will tell them the characteristics of the vaccines, educate them about some adverse reactions, and seek their consent before the vaccination. And during the vaccination, recipients must report their health data, their health status to the doctors, so that the doctors will have a judgment of how they should deal with the recipient's situation. And we also require the recipients to stay for another 30 minutes after the vaccination. The purpose is that once there were serious allergic reactions, they could be treated on the site. 90% of the serious adverse reactions happen within 30 minutes after the vaccination. And there are some cases that are caused by some psychological activities. For example, the recipients are too nervous, and these adverse reactions induced by the psychological factors are usually also happen after 30 minutes after their vaccination. So if they leave too early, then they might not be able to receive treatment as soon as possible. So that is why we ask the recipients to stay on the site for another 30 minutes. And after they leave the site, if they suspect any adverse reactions, they can seek medical services. Just a correction of the occurrence rate of serious adverse reactions, that is less than 1 out of a million.
Question from Reuters. So I was interested, Mr. Zeng, earlier you said epidemiological investigation will be given a priority. What discoveries has China made so far with regard to the origins of COVID-19? And WHO team of investigators are going to come soon, and they said they're going to go to Wuhan. Where exactly, when are they going to come, and where exactly in Wuhan are they going to go, and what do you hope that they discover? The other thing is about the vaccines. Will China be providing its vaccine to any other countries? If so, which ones? And just now we talked a lot about the vaccines being free for people. Are the vaccines also voluntary, as in are people free to choose whether or not they wish to have them, or are some people being required? Thank you.
路透社记者，刚刚曾部长您说中国会优先的进行流调的这个进行，那么中国在新冠病毒的溯源方面有没有什么新的发现？大家也知道，世卫组织的调查队将会很快的来到中国，他们也会去到武汉。那么世卫组织的调查专家组什么时候会来到中国？他们具体准确的是什么时候会去到武汉？中方希望他们能够有哪些发现？另外一个问题，关于疫苗，中方会不会向其他的一些国家提供疫苗？如果是的话，会向哪些国家提供疫苗？刚刚您也提到了疫苗是免费的提供，那么这个疫苗接种到底是不是自愿的？人们有没有选择打或者不打疫苗？还是说有哪些人群是必须要打疫苗？谢谢。
问题比较多啊。
这是就是两个问题啊。我前面那个问题。
Well, I will take your first question, and your second one we will have my colleague here. On source tracing of the virus, China has always taken this issue very seriously. From the early stage, we've focused on source tracing, hoping that we can identify where does this virus come from. We have organized several teams to look for the source from different perspectives. We've always been highly responsible on this matter and have adopted a science-based approach. We've done quite a lot. So, China supports and welcomes the WHO expert team to come to China and to come to Wuhan. We've had 4 video conferences with WHO teams. And each time, we've had full and science-based discussions on the virus. We've talked about the details of investigation, the procedures of investigation, relevant plans, etc. So we've had candid discussions and we've reached common understanding. So now we're waiting for the team to come. We have already put in place a task force to communicate and reach out with the WHO team. And on China's task force, we have experts on clinical trials, on infectious diseases, etc. We're still working out a specific date with the WHO, but everything on China's side is set. So when WHO experts finish their procedures and when they can finalize their schedule, they will be able to visit Wuhan. So, to put it simply, we welcome supports and we're open-minded about the WHO's team visiting Wuhan. We hope that their visit will lead to new discoveries and provide further help for us to understand the origin of the virus. I believe as long as we take a science-based approach, we will better understand the virus. We know that we are always refining our understanding of the virus. So we welcome more experts working with us on source tracking of the virus and help us better understand it. I believe it will also help us to better prevent communicable and infectious diseases in the future. So we do welcome and support such efforts. Your second question is on providing vaccines to other countries. At the 73rd World Health Assembly, President Xi Jinping pledged that China's vaccines, once ready and available, will be provided as a global public good. We will contribute to vaccine affordability and accessibility for developing countries. And Chinese companies, when working on the production of our vaccines, have taken into full account the need of other countries. While meeting the need of domestic recipients, we have also taken into account the needs of other countries. Next question, please. In Shijiazhuang province, in the city of Shijiazhuang of Hebei province and other places where there are newly confirmed cases, how will inoculation be introduced? Thank you.
Thank you for your interest of this question. Previously, the Hebei province, according with the deployment of nationwide vaccination program of key groups of population, they have already vaccinated 140,000 people. Now they are making faster efforts to finish the vaccination of the key groups of population, and they will also do a good job in implementing the control measures. The public is also required to do individual protection measures. Now, about whether we will adjust the vaccination strategy in light of the latest developments in Hebei province, in Shijiazhuang, the city will take into account of the need on the ground and the other policies. Let's get to the next question. Thank you from China Daily. Now, what are the contraindications of the approved vaccines?
Well, thank you for your question. Your question is about contraindications. It means the conditions under which people should not be vaccinated. Some of the contraindications are absolute, means that they will not be suitable for vaccines no matter what. But others may be temporary. So in cases when contraindications no longer apply, these people will be able to get vaccinated. Generally speaking, contraindications may apply to the following. First, people allergic to the vaccines or to the ingredients of vaccines. For example, after the first shot, they experience allergies, then they will not be suitable for the second shot. Secondly, people with acute diseases. And thirdly, people who are in the acute phase of chronic diseases. Fourth, people who are having a fever. And fifth, pregnant women. So they are people who, for now, are not suitable for vaccines. For those who have cured from their acute diseases or have moved out of the acute phase of their chronic diseases, they will be able to get inoculated later. All these contraindications have been specified in the user guide of our vaccines. And as I've mentioned, the contraindications may change. As we conduct more research, we will have better understanding of the virus and of the disease. Let me give you one example. Let me take flu vaccine as example. In the past, pregnant women were deemed unsuitable to be inoculated against flu. But later, with more data, we found that when pregnant women contract flu, there is a higher possibility of them developing severe symptoms, and their fatality rate is also higher. And further research found that the possible adverse reaction among pregnant women was similar to other general public getting inoculated. So based on that research, China and other countries, as well as the WHO, have then listed pregnant women as a priority group for inoculation. So this means that as we come to better understand the disease and the virus, there will be adjustments to contraindications. Thank you. Next question, please. From CCTV, starting from January the 1st, we know key groups have started to be inoculated. So when will the other general public be ready for inoculation? Will there no longer be nucleic acid test requirements for them to get inoculated?
Okay, I'll take this question. Well, at our last press conference, we did an explanation of our vaccination strategy. That is a three-step strategy. In the first step, we started our vaccination for the key groups of population since December the 15th. Key groups of population mean the people with higher risk of exposure to the cases. For example, people working in flights, in customs, borders, and ports of entry, and other jobs with higher risk of exposure. So we need to do a good job of inoculating these high-risk groups of people if we want to prevent case importation. So that was the first step. And the second step, we target high-risk population, which means people who are more likely to develop into severe situation once contracted. For example, old age persons, people with pre-existing chronic diseases, for example, people with diabetes. They are more likely to develop into severe or even fatal cases once contracted. That was the second step, to inoculate these groups of people. And the third step will come to the ordinary people. So why did we make this strategy in this order? Because the production capacity of the vaccines can only increase in a gradual process. So we made this strategy according to the increase of the production capacity of the vaccines. So we came